Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Today I want to introduce you to William McArdle, Frank, and Victor Catch. So they've written these outstanding textbooks like Sports and Exercise Nutrition, and also these incredible textbooks on exercise physiology. So these are textbooks that health practitioners have. It's main textbooks in key academic courses. These are leading experts in exercise physiology and the role of nutrition as it applies to enhancing athletic performance. They review all the studies on that information, but they also review studies looking at diet and lifestyle and the prevention of disease and also health promotion. Now, one of the small sections in their book deals with soy protein, which I wanted to bring to your attention today. So they make the point that in North America and much of the developed world, people now consume 2/3 of their protein from animal foods, whereas 90 to 100 years ago, protein consumption was equally divided between animal and plant-based foods. So we're eating way more animal foods now and fewer plant foods. Now, although protein derived from animal foods provides more optimal concentrations and proportions of the essential amino acids the body requires to synthesize all the key proteins that it makes, like muscle and immune factors and enzymes and so on, many animal products are also very high in saturated fat, which raises cholesterol and increases the risk of heart attack and stroke. And higher animal fat consumption is also linked to increased risk of reproductive organ cancers in men and women, as well as colon cancer. And animal foods lack many protective phytonutrients that help to defend us against cancer development, free radicals, and environmental toxins, whereas plant-based foods tend to have those protective nutrients. Most people know that combining certain plant foods, we can provide all the essential amino acids that the body requires to make all its key proteins. So for instance, grains lack the amino acid lysine, and legumes like peas and beans, they lack the amino acid methionine. But when you combine grains with legumes, such as having tortillas and beans or pasta and beans, together they provide all the essential amino acids required to make all the key bodily proteins that the body needs to make. However, the one plant-based food that contains all the amino acids required for the body to make all the key proteins is soy protein. So soy products that are derived from the soybean, like tofu and miso and tempeh and soy protein powders, and even just eating soybeans themselves. Not only is soy protein a good source of all the essential amino acids for protein synthesis in the body, but controlled clinical trials generally conclude that substituting soy protein for animal protein, so having a soy-based product instead of steaks and ribs and pork chops and hamburgers and ground beef and lamb and cheese and so on, decreases blood pressure, decreases triglycerides, decreases total cholesterol, and also the artery clogging oxidized LDL cholesterol, the bad cholesterol. And soy protein has also been shown to raise the good cholesterol, the HDL, that removes cholesterol from the walls of the artery, takes it back to the liver to be metabolized. Soy protein also lowers homocysteine in the blood, which is another very dangerous compound that contributes to heart attack and stroke. And in addition, higher consumption of soy foods is linked to the prevention of prostate and breast cancer, as well as helping to prevent the recurrence of breast cancer in breast cancer survivors. We think that the isoflavones genistein and diadzine, as well as protease inhibitors, appear to be the really important anti-cancer agents in soybeans and soy products that we consume. So, cutting back on high-fat animal foods, with the exception of fish, which has the omega-3 fats, which are great fats, but cutting back on the other high-fat animal foods is a health strategy I would implore you to follow, as well as eliminating deep-fried foods and breaded foods and battered foods and creamy salad dressings and all these other bad fats. Instead, using skinless chicken breast and turkey breast and Cornish hen, as well as egg whites, non-fat and 1% milk or yogurt. These are all great strategies to cut back on saturated fat. But I would also encourage you to consider soy foods in your diet if you haven't done this already. You know, tofu can be added to a stir fry or a teriyaki dish in place of other meats or poultry. And soy-based veggie burgers and veggie dogs are another good alternative to high-fat meat products. And the use of a soy protein shake is also a great consideration to bump up your daily protein intake if you're not getting enough protein. And the inclusion of soybeans or edamame at meals is another way to get the benefits of soy, as well as consuming miso soup and the use of tempeh. And there's a product called textured vegetable protein, which is largely soy-based, that can be used as a substitute for ground beef and chicken and turkey in meat sauces, lasagnas, and in cabbage rolls and those types of foods. So one of the simple ways to help keep your cholesterol and other risk factors for heart disease in the ideal range is to substitute soy products for animal products. It has a lot of protein, a complete protein. It's a strategy that is also very consistent in the clinical trials that show you get these great benefits with respect to a reduction in many risk factors for cardiovascular disease and other health issues. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.